additional case of COVID-19 here in Nova Scotia.
Thank you, Premier. And yes, today we have one additional case. Like other cases, it is related to travel outside of the country. That brings the total to 15 cases of COVID-19 in Nova Scotia. 5 now are confirmed by the national lab, and the other 10 are presumptive based on testing here in the province. Those cases are located in communities across the province. The age ranges we're dealing with are people from in their 20s to their 70s. As I said yesterday, we had one case of a hospitalization. Everybody else remains recovering at home under self-isolation. In all of our cases, public health has done extensive contact tracing. So we identify people who have been in close contact, and any of those individuals are then put on self-isolation for 14 days. They monitor their health, and public health checks in with them on a daily basis. We continue to test significant numbers of people. To date, we've now had almost 1,550 negative test results. So as the numbers of cases, I fully expect they're going to continue to happen and will rise. We're all likely to see community spread within Nova Scotia, and we're actively working now to expand our surveillance system to detect any such spread. I just want to touch bases on a couple of other issues that we've talked about throughout the week. One is around N95 masks. We know that the virus that causes COVID-19 is a respiratory virus spread by what we call droplet spread. The science and the global experience with COVID-19 tells us that regular routine care of patients with this type of virus can be safely and appropriately done with personal protective equipment consisting of surgical mask, eye protection, or goggles, gowns, and gloves. This is absolutely consistent with the World Health Organization and national recommendations for infection control for COVID-19. For this type of respiratory virus spread by droplets, N95 respirators are only necessary when conducting specific, what we call in medical language, aerosol-generating medical procedures. The most common one when we'd have to put a breathing tube down somebody's throat. With this pandemic, there is an increasing global demand for masks and equipment. And it's very important that the use of all masks, including N95s, is only done when appropriate and necessary. We are working with our federal and provincial territorial partners to secure additional supplies of personal protective equipment, and there's a bulk order for that actually going in today. And we're also reaching out to other industry partners outside the healthcare sector, such as the construction industry, for any additional supplies of things like N95 masks that they might not be using at this time. I'd just like to shift quickly to 811. 811 continues to experience high call volumes, and we're working very hard to build capacity and respond as quickly as we can. But it's important that I want to remind Nova Scotians that we need to use 811 only when necessary. So if you're just looking for basic information on COVID-19, please go to the government website, novascotia.ca/coronavirus. If you're concerned you may have symptoms that could be COVID-19, use the 811 online self-assessment tool first. It will give you some direction. And then if you screen in through the online tool, then you can call 811 directly. They'll do a further assessment, and as necessary, will direct you to one of a number of COVID-19 assessment sites that have been opened up by NSHA around the province. The other piece is for people who have other health issues that are not related to COVID-19, 811 is still there for you, and you need to call 811 if you think you need some direction about what kind of care you might need. I'll hand it now back to the Premier.
Thank you, Dr. Strang. And on behalf of all Nova Scotians, let me just say thanks for the tremendous work that you're doing. And please pass on to your wife and children our appreciation for their sacrifice and the work that you're doing on behalf of all of us.
I appreciate it. If I can say, I said to you last night, I'm only the face of this. There are hundreds and hundreds of healthcare workers and public health folks working 7 days a week on this right now. So thank you.
And I want to echo the doctor's comments and offer my thanks to many of the frontline healthcare workers, home care workers, pharmacists, who across the province are responding to Nova Scotians and not only for COVID-19 but for other health challenges in a very stressful environment. And we want to say thank you for your continued professionalism and say thank you to your families. I know your loved ones are sending you out the door in the morning to go to work with a higher level of anxiety than would have been a few weeks ago. So on behalf of all of you, on behalf of us to all of you, just let me say thank you. And to all Nova Scotians who have been working diligently to take care of one another, it is critical that we continue to think about our neighbors, think about our family and friends, know of someone who is in our communities that may not, quite frankly, be living alone, may not have family around, to pick up the phone, call them, reach out to them. That even though you may not have physical contact, any contact and point of contact that you make to a neighbor is important. And we want to just say, continue what you've been doing. We can't become complacent. As Dr. Strang has said many times, we're at the front end of this. This is coming to our province at a greater rate. And we need to make sure we continue to do the due diligence that we've been doing, and caring for one another is probably as important as any medical intervention we're going to make. That contact of kindness really does matter and goes a long ways. I also want to say to the business community that is out there, we recognize these challenges have created a lot of pressure on you. Whether it is a small or medium or large size business, we want to tell you that we are here and working with you and thinking with you. We're working with our national partners. We appreciate what has happened at the national level with the national government and our national banks when it comes to individual mortgages. We need them to take it a step further. We need them to look at commercial loans that are out there. Our business industry, our business community needs your support. We shut down really retail in this province. We shut down the restaurant sectors. All of those are sitting there, small business owners who have rents to pay, to people who have corporate loans. We need those corporate loans to be deferred for a period of time so that the landlord can defer the rents to those small businesses. It will be critical in order to keep them in business as we go forward. So we want to continue to work as a federation, across the federation, with our partners, with all provinces and national government, and work with the national banks to ensure that we as a country come through this, but at the same time we will have the ability to respond economically in a very short order when public health gives us the ability to begin to allow our economy to move forward. So we're going to continue to fight on behalf of Nova Scotia companies, but indeed on behalf of the Federation, that we provide some support on those commercial loans that can allow the supply chain to be relaxed a little bit and take pressure off our small business community, who we've literally closed down for public health reasons. And today we're here with the Minister of Business, so there are some things that we specifically can do as a province. And I want to thank Minister McClelland and his team at Department of Business for their tremendous work. And I now will turn it over to him.
Thank you, Stephen. Good afternoon. I've put together a rapid response team to begin identifying ways to support our businesses during this time of uncertainty. We have been working with the Chambers of Commerce, Crown corporations, our provincial and municipal partners, and our tourism stakeholders to better understand the needs of small and medium-sized businesses. Our focus here today is on those most impacted. Today, we are announcing $161 million to immediately address cash flow and access to credit for Nova Scotia small and medium-sized enterprises. Effective immediately, we will defer payments and interest for government loans, including those under the Jobs Fund, the Municipal Finance Corporation, and Housing Nova Scotia. Government will defer business-related fees until June 30th. A list of those fees will be posted online in coming days. Worker compensation premiums will also be deferred, keeping $60 million in the hands of Nova Scotia businesses as well. Loan payments under the Small Business Loan Guarantee Program, administered through the Nova Scotia credit unions, will also be deferred until June 30th. We are enhancing that very program, making it easier for small businesses to access credit up to $500,000. For those who might not otherwise qualify for a loan, government will guarantee the first $100,000. For those employees and small businesses who are now working from home, we want you to have the internet access that you need. We've already committed $46 million to expand internet access across the province. Today, we are announcing an extra $15 million to incent providers to speed up projects and have them complete as soon as possible. Increased internet coverage in rural areas will help more businesses tap into e-commerce in a time of social distancing and allow people to work more easily from home. It will also support better access to e-health. As I stated off the top, we are focusing our first wave of supports on those most immediately impacted. We will continue to work closely with the business and social enterprise communities across Nova Scotia, and of course, we are prepared to take further action. Back to you, Premier.
Thank you, Minister. In addition to those announcements the Minister made, next week we will be laying out an aggressive package of capital projects that are the responsibility of government, and we'll have more to say about that next Monday. As well today, in addition to what the Minister just announced, to our students who are concerned about making payments to their student loan, as of March 30th, we will suspend Nova Scotia student loan payments for 6 months until September 30th. Students do not have to apply. That will be automatic, become effective on March 30th. Effective immediately, all loans through the Fishery and Farm Loan Boards will be deferred until June 30th. I've instructed a special prompt payment process for small businesses who do work on behalf of government. This has already resulted in 5-day turnarounds for payments to small business, not the traditional 30 days. This new system will put cash in the hands of our small business operators and their employees. With regards to our key industry, fishing, farming, and construction, I've heard from you, and I know the anxiety that many of you are feeling. Planting season is about to start, fisheries is about to open, and construction projects across our province are underway. To those industries, we are working closely with public health officials to ensure that you can operate safely. Your sector is an important part of our economy. We want them to continue to provide employment and keep the economy moving while public health advice, including social distances, is followed. We all need to do our part to prevent the spread of this virus. But it's important that parts of our economy that can operate need to continue to operate to provide the support for families across our province. And we can do so in some of our sectors by following the advice from public health. So again, to Dr. Strang.
Thank you, Premier. So it's important to remember where this is the end of week 1. We're into this for many weeks. There is going to be more spread in Nova Scotia, but the things that we've been talking about all week, so the importance of everybody, including people in the industries we just talked about, taking the personal preventative measures. How do we support good hand washing, social distancing, staying home if you're sick, as well as complying with all the measures we've done to prevent groups of people gathering together. That's all about preventing the spread of the disease. How much this affects Nova Scotia and how much we were able to protect those who are most vulnerable, seniors, people with immune compromise conditions, and how much we are able to sustain our healthcare system, it really all depends on how much we take together all these actions and how we support each other so we can all be as preventive as possible and remain as healthy as possible.
Thank you, Dr. Strang. We'll now go to the phone lines. Again, just a reminder, keep your phones on mute. I will take one question and one follow-up from each outlet. We have 15 people on the phone who have questions. We may not get up to all your questions today. We'll do our best. We have approximately 25 minutes. We will start with Jean Laroche from CBC. Go ahead, Jean.
Hi, this is for the Premier. I understand what you're doing for all businesses who have loans from the government or who deal with the government. What about everyone else? Number of cafes, number of shops that you have ordered closed are really hurting, and they have rent due.
So as part of what Mr. McClellan just announced with the credit union loan, that's available to all those small businesses. We would underwrite the first 100,000 for security for the credit union. At the same time, opening when I started, we need a national program when it comes to the commercial lending in this country. We have a lot of major developers who have property that they're renting out to, whether it is to a cafe or a restaurant, that payments due. We need those deferred, and we need those developers to pass that deferral on down to allow that rent that is due to be deferred as well. And we'll find our way through this, but it will require a national support from the federal government and our national banks. And I can't stress this enough. It will be critical that they can